The medical community is gradually coming around on this weight loss surgery as a reasonable means of treating people's excess weight. For a long time, doctors were tied into this idea that patients could lose weight if they just exercised more or dieted more. But doctors are starting to see more and more that weight does cause medical damage and diet doesn't work very well, and that surgery is safe and surgery is effective. And so happily, we're growing this sense of reliability and sense of acceptance in the medical community as a whole. Many patients encounter a doctor who doesn't believe in this surgery, but that's probably because that physician hasn't had personal experience with the operation. Any patient that's meeting a physician who seems to be a bit uncomfortable with the idea, we're happy to talk to that doc or let them know some about how surgery goes, what the outcomes are in terms of weight loss, in terms of medical improvement, and also in terms of low risk that's acceptable. Now, people get a little bit confused these days about how heavy a person needs to be in order for surgery to make sense. The rate of weight and the rate of obesity in America is just rising in a striking way. And so we get used to seeing people walking around in our grocery stores and seeing them in our restaurants and our workplaces who are just big. And you get used to that, and you say that people that are big they're okay, but the medical data says that that's not the case. The medical data says that when a person gets to be about 70 pounds overweight, that weight is causing medical damage, and so that needs to be treated in some way. There needs to be some intervention to bring that weight down. And it's really appropriate to start off with things that don't include surgery, like diet and exercise and maybe some medications, but you need to be ready to go on to the next steps. If your weight is 70 pounds this year and it's 80 pounds overweight next year and it's 110 pounds overweight after that, you need to do something different and not keep trying to do the same thing over and over again. That's where surgery comes into place. There continues to be a misunderstanding in society, like a prejudice against obese people. It's almost as if people believe that fat people choose to be fat, and that just does not fit with the facts. There's growing medical evidence that obesity is a biological problem, and it's a lifetime biological problem. So we need to get away from this idea that it's the easy way out to choose surgery. Once other medical therapies like diet and exercise and medications have been exhausted, then surgery can be a very appropriate next step for people who have failed other means. The decision about who should have surgery is simple and complex at the same time. The simple part is the medical and the logical data. We know a couple things. We know that number one, weight hurts people. Weight causes major medical problems like diabetes and high blood pressure and reflux. We know that it causes ongoing damage to the body every day a person lives with it. We know that diets don't work very well. We know that less than 5%, really around 1 or 2% of people, once they get to be about 100 pounds overweight, only 1 or 2% can succeed with dieting and other means of weight loss besides surgery. We know that surgery is safe. We know that surgery is effective. We know that surgery can get people to lose 50 pounds, 100 pounds, even 200 pounds when the patient works well with the surgery. So the logic and the statistics are that we've got a situation where the risk of the surgery is here, and there is some risk, but the risk of the weight is really here for most patients. And so from a logical standpoint, it's real easy. But the complicated part is this patient decision process. We believe that patients should go into surgery only when they have a deep and firm sense of conviction that surgery is the right thing for them and really a necessary thing for them at this time in their life. And that means that they've been through everything else that they can do to try to lose the weight, and they've come to a place where they see the weight as something that's impairing their health and is going to make them sicker and sicker in the long run. At New Dimensions, we're trying to offer a spectrum of surgical procedures to suit different patient needs. I'm happy to say that most patients can do well with any of the surgical procedures that we offer, and the two most common procedures now are the gastric bypass and the gastric banding procedure. We also are starting to look a little bit at the gastric sleeve operation. For the most part, believe it or not, we're going to want the patient to choose which is the right operation. And that may sound weird because it may seem to the patient that the doctor should know best or something like that. But the thing that turns out to be the case is that having active patient participation with the surgery is so important for life after the surgery that we want to make sure that the patient chooses the tool that they're going to use for their lower weight and life success. It's kind of like if you went for car shopping and you like Fords, it wouldn't be right for somebody to make you buy a Chevy. Well, that's kind of the difference between the gastric bypass and the band, because both of them are very good choices and both of them are going to act differently with you. So the key features of the gastric bypass that patients need to think about are that the gastric bypass is a kind of complicated operation. It's complex, but it's been around for a really long time and it's very well understood, and we know exactly what it does and what it doesn't do and what it does that's good and how it can cause problems. It's what people call the gold standard of surgery for weight loss. The adjustable gastric band is a newer procedure, and we've had good 10 years of experience with it now. So it's not exactly new, but it's something that we don't have 15 and 20-year results with. The gastric band is a procedure that is less invasive or less traumatic on the body than the gastric bypass, because the band involves just putting a little ring around the upper part of the stomach, whereas the gastric bypass involves cutting across the stomach and bringing intestine up and attaching it to the stomach. Very different operations. The outcomes are all about the weight loss. And with the gastric bypass, we see very reliable, very substantial weight loss to the tune of 70 pounds, 100 or 200 pounds, depending on where the patient started. With the adjustable gastric band, we see weight loss that can be in that ballpark, but on average is a little bit less than the gastric bypass. And there is some variability about the band weight loss. There are some band patients, maybe 20%, who only lose 20 or 30 pounds. And that comes from a variety of causes that we can talk about one-on-one with your surgeon, but we do see that variability.